Hi everyone, welcome to Kun-Ling Lab. The topics in our labs are surrounding cardiovascular diseases. Thus, we need to cooperate with many doctors in clinic, including hematology and oncology, cardiology, chest medicine, orthopedic fields. I enjoy doing basic molecular biology experiments. I love to discuss research issues with all lab members. Now, let's talk details about lab study.
Our laboratory was established in 2015. We are devoted to cardiovascular, exercise physiology, and related research, including basic cell molecular biology experiments, animal experiments, and clinical human trials. Cardiovascular disease refers to disease related to the heart and blood vessels. Common heart, brain, and peripheral vascular disease, such as coronary heart disease, cardiomyopathy, atrial fibrillation, and myocardial infarction, stroke, and etc. The pathology of different diseases is different. Heart disease and the fourth cerebral vascular disease as well as vascular disease caused by hypertension, diabetes, and kidney disease are the top 10 causes of death in 2019. These are all part of the cardiovascular disease that needs to be taken care together. Atherosclerosis due to blockage of the coronary arteries that provide blood flow to the heart, and the myocardium does not get enough blood, and oxygens to cause damage and necrosis. This affects the normal function of the heart and cause coronary heart disease, also known as myocardial infarction, and there's a risk of sudden death under severe condition. Many studies has pointed out that oxidized low-density lipoprotein can cause atherosclerosis damage. The positive regulation of oxidative pressure and the production of reactive oxygen species are the keys to vascular atherosclerosis. Our laboratory research found that most oxidative stress is related to oxidized low-density lipoprotein receptor 1, protein kinase C-beta, NAD-dependent acetylacetoin 1, protein kinase B, AMP-dependent protein kinase, endothelial nitric oxide synthase are related. We use many typical biomolecular techniques, such as Western blotting, flow cytometry, spectrophotometer, and immunofluorescence staining assay, to implement our experiment and analyze our result. In the cell research level, we established the hypoxia model of cardiomyocyte and explore that interleukin-20 plays an important role in cell apoptosis and abnormal cell function after hypoxia and reperfusion of cardiomyocytes. We proved that interleukin-20 can pass through PKC and NADPH pathway. The oxidase and AKT pathway induce cell apoptosis via hypoxia and reperfusion. This study found that interleukin-20 was found in large amount in vitro. It raised heart damage by hypoxia and reperfusion. Therefore, the positive regulation of IL-20 may lead to cardiomyocyte apoptosis. This research cooperated with Professor Mingxi Zhang from the Institute of Biochemistry and published the important research result in Antioxidant Journal. In the animal experimental model, we established myocardial infarction model rats. Through drug treatment, explore cardiovascular inflammation and physiological parameters, and understood its improvement through cardiac ultrasound, blood testing, and other data. We used SDB6 ApoE knockout species rat and mice to examine the experimental design. The important skills contained in the experiment are feeding different drugs and training rat and mice running exercise on the treadmill machine. In addition, through the running exercise training of rate, the cardiotoxicity mechanism and the evaluation of cardiopulmonary function of rate after administration of doxorubicin and paclitaxel were explored to reduce the side effect of chemotherapeutics. We are looking forward to that the successful experimental model of rate will be used in clinical research. In human study, our research findings are achieved through collaboration with physicians from the multiple departments of NCK Hospital. We aim to investigate exercise physiology and training effect in various populations, including heart failure cardiopulmonary rehabilitation, inspiratory muscle training, and pulmonary rehabilitation in patients with upper abdominal and spinal surgery, physical therapy and cardiotoxicity induced by cancer treatment, and efficiency of eccentric exercise training. We explore the research results by means of cardiopulmonary exercise tests and exercise electrocardiogram to examine exercise capacity of patient and prescribe exercise program. Eccentric and concentric ergometer training and treadmill training are used to conduct aerobic exercise according to personal ability. Pulmonary function tests and diaphragm ultrasonography are used to explore the effectiveness of respiratory muscle training. At the same time, we will participate in cardiopulmonary physical therapy clinic to provide lung rehabilitation programs for patients with chronic obstructive pulmonary disease, and provide patients with exercise prescription and follow-up regularly. Dr. Tsai's instruction and teaching style are based on students' autonomy and teach students in accordance with individual aptitude. Students profit most by getting access to different research methods to verify scientific questions and hypotheses. Therefore, students eventually are capable of extending research questions from basic experiments to human study and applying to clinical physical therapy. Welcome to our lab.